So I have our client on the table. She's in the prone position, which means face down. I have a bolster under her feet, and this is how I normally begin my 60-minute Swedish massage. First, I look at the breath and I see how they're breathing, and I just get an overall sense of how their energies are, and I connect up with them energetically and psychically, empathically, telepathically, kinetically. And so in the beginning, I just connect, and I begin by doing some light compressions on the sacrum and the spine, and I'm just getting a sense for the overall condition. I've already done my postural assessment, so I have a good idea about what's happening in her body, and that's why I have her in the prone position, because we gathered all the information in the beginning and we decided that we're going to start on the back. So during your postural assessment, you'll make those determinations if you decide to start on the front, side, or back, or seating, or however you're going to do it. So moving on my way down here, I'm just checking for any hypertonicities. I'm looking for movement, so I'm doing some slight jostling here just to see how it's moving. And it's moving pretty good, but I can already see that there's something happening up here in the left upper quadrant. So that's an indication that it's going to be ESGs, erector spinae group, upper trap, fibers of the upper trapezius, and latissimus dorsi. And so all of those are muscles I can feel already are a little bit hypertonic, so they're pulling the rib cage medially on her. So her rib cage is actually out of position a fair amount. I mean, I would say a moderate amount on that. So as I work my way down here, I'm checking the hamstrings, and they feel pretty good on this leg. I'm moving my way down. I'm checking the popliteal fossa. I'm checking the insertions of gastrocnemius and semitendinosus, as well as the peroneal compartment. So that would be peroneal brevis, longus, all the peroneal muscles, and there is some hypertonicity in that area. So I know I'm going to be spending a little bit more time on this leg here in the peroneal compartment. And as I move on down, I'm checking the Achilles, gastroc insertion on the calcaneus, as well as soleus. And now I'm on the bottom of the foot. I'm checking the heel for movement. And now I'm also checking the insertions of the peroneal muscles, because they insert on the metatarsals up in here. So I'm gathering information as I move along. And go ahead and take a nice deep breath for me, please. So not bad for the breath. She's got a pretty good breath. We're just going to see if we can increase that volumetric capacity and help her be able to have a little bit better posture. So we're doing Swedish massage today. So that's a particular kind of modality. As I explained in the introduction, there's two different types of Swedish massage. There's a relaxation Swedish massage, and there's deep tissue Swedish massage. In this kind of session, because of what she has going on in her body, I'm going to probably focus a little bit more on the deep tissue. So that means a little deeper pressure, more direct site-specific points as we go. So I have her draped nicely with a nice sheet. I'm just going to bring the drape down, exposing her back, the area that we're working on. What I like to do is just tuck the drape into the shorts or underwear or whatever they have on, so you don't get any oil on their clothing, you know. And I ask them to bring their hands out so their hands are on top of the drape. You can do that across the body, it's okay. So now the skin is exposed and we can see with our eyes what's happening. And like I said earlier, as I was palpating her, I could see that this left rib cage is torqued. So it's rotated. Okay. So I apply, in Swedish massage, you apply the oil using a stroke called Effleurage, which just means a light touch. Today I'm using, normally in my massages I use sesame oil because I like the viscosity of the oil. It's a little bit thicker, heavier oil, so it gives a nice slip when I'm doing linear strokes or direct pressure. I have much more control over than say like a thinner lotion like oil like coconut oil or lotion or something like that. So I like sesame oil. I also like hemp oil. I like almond oil. I like traditional Ayurvedic oils. They're all really good. So, but normally I use sesame oil. So now I have the oil amount that I want on my hands, and now we apply the Effleurage Stroke. So it's just a very light touch on the surface of the skin. This Effleurage relaxes the central nervous system, and initially it increases the heart rate a little bit, but after a few minutes, the blood pressure starts to go down. So if you're a person that has low blood pressure, it's okay. Just make sure that you're comfortable with it and that your blood pressure doesn't drop too much. You might want to check with your doctor if it's okay. You might want to go with like a vigorous massage, like sports massage or something like that. Okay, so I'm just being conscious of her system. I'm feeling the electromagnetic circulation. And in her, I can feel that the energies are blocked in certain areas, especially like I mentioned already about 5 times this area. So I'm gonna pretty much, I understand that my focus is gonna be more on this upper thoracic area than say the lumbar region, for example. Every client is different, of course. That's why we do our postural assessment. And in the beginning, I go around and I palpate and I just get an idea. So in her case, her low back feels okay. So I've pretty much finished the application of oil and the effleurage. So now I'm going to go into the tissues a little bit deeper with a stroke called Petrissage. So Petrissage can be a few strokes. It can be open C, closed C. So that means you make motions like this with your hands. C, open C, closed C. So open C, closed C. All right. So now I'm getting a little bit deeper in there, a little bit more feeling about what's really going on. And as I'm working, I can understand now I need to change into a linear friction, a palmar linear friction, this is called. So I'm using the palm of my hand here and I'm doing long, deep strokes down the erector spinae group. I'm follow it all the way down to the insertion. I just had a little adjustment in the sacroiliac joint there. So just that very light touch has already created adjustments in the sacral area. So now I'm coming up to the thoracic really here where the ribs insert into the vertebral columns. So the ribs are running this way, but the muscles are running this way. So I'm applying direct pressure at the very point where the rib head articulates with the vertebral column, the vertebrates. And I'm just pushing on the rib head just a little bit to try to give it some movement and to communicate to it that, hey, it's okay to move. I want you to move a little bit. So I'm asking you to move. So I'm just communicating with it a little bit. This person has had a lot of body work, so her muscles understand what we're asking it to do. But if it's a new client, it might take a little time to get the communication going with the client. So you might have to spend more time warming it up and everything like that. Okay, I've already released a few of the rib heads along the vertebral column. I'm going to come out to the edge of the scapula now, where the rhomboids insert. The rhomboids are pulling on those ribs a little bit, and they're also slightly hypertonic with adhesions. Not bad, but they are pulling on it, on the ribs. So I'm working my way down the medial side of the scapula, and now I'm connecting into the lats, latissimus dorsi, and the internal and external obliques. So I can feel them, I can feel that the communication between the musculature is confused. They are not communicating together effectively. One muscle is doing one thing, another muscle is doing another thing, and they're not agreeing on their mission in life here. So muscles take time to change. They're very slow. I mean, they're organic, you know. They're kind of like a tree or something. They're not that slow as a tree, but it's organic like that. It takes time to change. So in this particular case, we're trying to make a change in her structure. So you don't really want to be doing a lot of fast massage. That's not going to change the structure. That'll increase your circulation and break down scar tissue and everything like that. But if you want to make a change in person's structure, you'll find that the best way to make that change is in the slow and deep. You need palpation skills to do that. So you need to know anatomy, kinesiology, so that you know where you're at. Some clients really demand a super technical massage, and you have to be your palpation skills need to be really right on. Other people don't really care about that. They just want to feel better. So I'm putting a fair amount of pressure on here. If you're not sure how much pressure to put, push, press, you can ask your client, and you can ask them like this. On a scale of 1 to 10, 1 being the least amount of pain and 10 being the most amount of pain you've ever felt in your life, how would you rate this pressure I'm pushing on you right now? So she says it's a 2. So that's not very much. So that means that you could sink in a little bit more, because you want to be at the most at about a 5 or a 6. If they say it's a 7 or a 6, you might want to back off just a little bit. But I know also that sometimes less is more. Sometimes, like in this particular instance, you don't really need to push harder because the changes are happening at a level 2 of intensity. So, you know, as I'm working my way down through the layers of tissue, now I'm really feeling the core of the issue. So it's right here.